I'm sorry for the technical interruption which we had. Once again, we are live, and I'm Dr. Dipandana Datta. I'm a genetic counselor, and with me I have Dr. Ranjan Ghosh of Medica Super Speciality Hospital, Department of Psychiatry. He is a board certified, American board certified adult and pediatric psychiatrist. Welcome, sir.
Thank you.
Today is we are actually speaking on mental health awareness. We see a lot of, as a genetic counselor, I see a lot of couples, I see a lot of kids who have a lot of issues but which are not really spoken about in the public.
Sure.
Sir, here today we would be discussing some of it. If you could just highlight.
Definitely. Before we get going, you had a lot of insightful questions, so thank you for being here. I really appreciate you for taking time off your busy schedule, really, honestly. It's an important issue. Let me just say, first and foremost, thank you to the whole Medica team, branding, our president of branding, our chairman, Dr. Roy, his belief in this CSR project, as well as belief in creating awareness for psychiatry, creating something that we have not done in a hospital setting, and all the Roys for that matter. And I feel like, honestly, if it wasn't for them, I'd be in some NGO somewhere impacting a little change, but now I can impact a lot of change. And that is very, very important to me, as this is my passion, and this is Mental Health Awareness Month. So thank you, Facebook friends, for also tuning in. Appreciate you.
Medica Super Speciality Hospital, like in a hospital setup, we normally see people going for cardiology, neurology, even if we have a flu, we run to a general physician. How often do you see actually people coming to a psychiatrist for a mental health issue?
Yeah, and I want to say, when I was coming to Kolkata, the research that I did was like shocking. Like 56 million people suffer from depression, and that's lowballing it because that is not the documented.
Yes, of course.
And another 38 million suffer from anxiety. 7.5% of our 1.334 billion people suffer from some mental health disorder. That is outrageous. And still, I get that feedback of, "Ami pagle doctor kache jabo na, ish, ki bhabbe lo." It means like so much to me that it's so sad that I can fix the situation, but lakhs and lakhs of investigations later, that they have to come to a psychiatrist and they still dread it at that point.
Yes, and of course it's taboo in India, where we are actually taught, your emotions are supposed to be in a bathroom or inside a house, inside a room. It shouldn't come outside. And when there are people who are showing off emotions, they are, sort of probably labeled as attention-seeking behavior, you're very emotionally labile. Why do you have to talk about this in public? And do you really feel that these are actually anxiety disorders which will just go off? Like, what do you have to comment on that?
So I feel like any behavior is telling me something. Even if it is attention-seeking behavior, I don't feel like we have the right to judge that behavior. We don't have the right to judge what's correct and what's not correct. We're all not professionals. Even sometimes I cannot judge or label. But I have the hard job of making sure that that person's voice is heard.
Right.
Once it's heard, then let us figure out what's correct and what's not correct.
Absolutely.
And why take a chance on something that could be nipped in the bud early and become more severe? So this is the stats again. Age 15 to 29, we have the highest suicide rate in the world. In the world. It is at 15% in West Bengal. All over India, it's 10%. Can you imagine that stat of people killing themselves in that golden age of producing a future?
And where, in India, we actually we are people who talk a lot. We have all these social gatherings, we are meeting people. So don't you think that, here things would have been actually lower, but what we see, what the stats which we are talking about actually shows that no, we are actually not speaking, we are probably not speaking our mind. And probably there is some underlying pathology which might, a person like Dr. Ranjan Ghosh, a psychiatrist, might be able to intervene or help. With this regard, I have this question often, I know many people will also say, do we consider that children, they can't have a mental issue? Like, is mental issue only, because you said 29 to 50, so is mental issue only associated with something which is in the adults, not in the children?
No, so I spent my whole life trying to prevent mental illness. And I honestly feel like we deny. So me as a parent, I'll just give you an example. I had a daughter, and she's being, she was raised by me, and I thought, honestly, I've given her the world. Why is she having depression? I don't get it. Amar dosh ki holo? Mane ki byapar? Ami to shock kichu dilam. And I'm a psychiatrist, mind you, child psychiatrist. But she had issues with biological father. She had issues with this and that. I am not to be blamed or personalized when a child gets depression or anxiety. It happens. I just told you guys the stats. It's too much to count. They have a voice. They need to use their voice. When you shut down their voice, it makes it worse.
So again, here I would just intervene. You said something like, I have given her the word, but still she has depression. This is something which I actually go on hearing. You have everything. Why do you have a mental health issue? Why are you depressed? Why can't you be happy with what you have? Happiness, like right now, we see it all the time. Happiness is an attitude. Wear it. Do you actually believe that?
So I do believe you can cognitively reframe your thought process.
Yeah.
I do believe that. But you can't pull yourself out of the dips of depression without help. There's nothing wrong with it. Diabetes, when you have a diabetic coma, that's equivalent to suicidal thoughts. Why cannot we treat the depression like diabetes? We prevent those conditions from happening. Why can't we prevent it in our youth?
Of course. And then we see kids, as parents, we see a lot of kids who are having learning disabilities, who are bullying other kids in school. Do you think that it also has something to do with the environment they are being brought up or their own mental health issues?
Yes, so I feel like there's so many things that our kids are telling us. So the number one thing that I hear from parents sometimes are, my kid has ADHD. And I'm like, okay, so they're hyperactive in school. Can you tell me why? No reason. The number one thing that comes into my office is anxiety. Anxiety causes hyperactive behavior and inattention. Number two might be depression. Number three might be social stressors, like their parents are arguing at home. There's so many things going on. But the parents are saying, there's no problem, that everything is perfect, which nobody's perfect, by the way. And that my child has ADHD. Please give them a medicine, let's fix this thing, and let's go. But it's not that simple. It requires some time. It requires me understanding the child. And sometimes no one's talked to the child. So I'm hearing things for the first time because they feel worried to even say it to people. So we have to really pay attention to our children.
And maybe think in a different light, because as parents we will not like to harm our kids, but probably the thought processing which we are having is not correct. It can't be that as parents we are always thinking correctly. So again, I would like to...
And I'd like to say this happens in the US, not just in India. It happens everywhere, worldwide. It's not, I'm not being specific for a thing. I know certain cultural norms here, and added stressors of competition and those things are very, very important to our culture.
Our culture, yes.
And I don't want to ever underscore that because I feel like there's certain goods with that. But that competitiveness in some things are killing some of the mental states of people.
Also, we see a lot of oppositional behavior from the kids. If one parent is saying something, the kids will immediately say, no, this is something I'm not going to do, I'm going to do something else.
Right.
And maybe there is just not the kid, maybe a family counseling in those cases would help.
It definitely helps.
In that light, there's some comments, we just take a few comments over here. We have Shuniba Shengupto who has asked that gadgets or mobile phones, are they adding to the anxiety and mental health issues, and how should we minimize them?
So there is some recommendations that they say for gadgets and mobile phones, but once a child gets in adolescent age, you have to regulate their gadgets by kind of like an incentivization. So, Judy ora pore, সবকিছু হয়ে গেছে বাড়ির ব্যাপারগুলো ঠিক আছে কাজ and they earn that gadget time so that time nobody should mess with them because they earn that time they have the freedom of going to play cricket using the gadget everybody's different I would prefer that people go outside but yes it is what happens what I hear the most guys and I think I've talked about this with you
yes.
is that যদি আমি ফোনটা নিয়ে নিই suicide করবে না তো I'm like no you're being a parent like please continue to be a parent like I didn't say stop being parents because we have mental health issues I'm saying be a parent because at that age people are craving discipline
so I believe the parenting has changed across how we were parented and right now because there are a lot of gadgets and it's not possible that you will keep kids out but restriction yes restrictive approach to everything would probably solve it the other issue which comes with actually children I feel having an issue or a depression is we see parents often saying that my relationship is perfect but their relationship is actually not working. There was an article in Toy which said that Indians have the lowest divorce rate. Is it scary?
So this is I'm kind of on the fence about this and I'll tell you why because I've been raised in America I've been raised in India both bicultural
right.
So America te ki hoy like they have too much freedom. They're way over here. Okay, so they have no fear. And we are way over here. Meaning we care about everything. We're scared about what the neighbors will think. Loki Pape, it's the biggest illness now in Kolkata, right? So we have this extra cultural layer of stress that we put on ourselves. And I'm in the middle. I'm not saying that American standard is good. That's why I'm here. That's why I came back. But I'm saying that this much stress when the culture is moving this way can never be good. We're stressing our children to the umpteenth degree. That's why we see some of these live Facebook suicides. Like that's why we see these things.
Like tell me something like I have a lot of friends also I see them they are in a marriage just because of the child or they are in the marriage because I can't say this to my parent even if my marriage is not happy I have to stick to it because I'm married to him
Right.
so or I'm married to him does this really justify
No. If the child is not happy if the parents are not happy the child will never be happy. Now, divorce has its own set of issues and problems, but done appropriately and done well with the help of a counselor, it works. I'm not saying go get a divorce. I'm saying if we can work out the couple, and if they really want to try, both parties want to be in the relationship, and both parties have their needs, specific needs, I can try to bring them in the middle. It shouldn't be for the child's sake, it should be for their sake.
Right.
Otherwise, it's not going to work. And what I'm seeing more and more, and if I'm to be blunt, culturally, people getting married early because the dating scene and whatnot is so difficult here. So it's like people get married and they have to stay married. It's like that life sentence, like you just said. And it doesn't have to be a life sentence.
No, but I have seen people, they have love marriages, they have chosen their own partners. But right now something is not working. It's not the fault of any of the partners. It's not working. But the person is in the marriage because of the society, because the parents say that you can't leave her. The society says that you have a certain position in the family, so you that, and then you are doing it for your child. The child says, I want both the parents. So you actually diminish yourself. You don't actually respect your own feelings, and you are in the marriage. It's not that they are fighting or something is happening, but it's just that it's not a happy marriage. Do you actually think that it's justified? Marriages like this.
Well, no, it's not up to me to decide what's justified, but what it's up to me is to tell you what I see in my office. Onek lok ashe because they're depressed in their marriage. I've counseled tons and tons of people because they come in, the number one stressor is that. So biologically so we work in 3 facets, biological, psychological, and social. Their social is that they have that strained marriage. Then they start developing biological components of depression and psychological traits, how they have been used to dealing with things. So they're dealing with it with an anxious mindset because low keep up it. So it's all of that together. Sometimes I see is the worst combination.
So we have few very lovely comments. Actually, I was about to ask this question. We often see death in the family, and how do you deal with the death of a parent? It does not matter if the parent is 40 years old or the parent is 90 years old. But how do you deal with the death of a parent and the fear of failure? This question is being asked by Pratyush Kota.
Right. Yeah, so I can relate to this. My only maternal figure passed away like 3 years ago, and I really loved her. And so the death of a parent is never easy, but there is life after that. So I'm living proof, right? So I think as a parent, if the question is if I'm understanding, as a parent, there are stages of grief and loss that the child will go through, and you will go through. First is denial. It means that eta hote pare na, right? Next is anger. Ragwa. You get mad at yourself, you get mad at others, you get mad at everybody. Then bargaining. Judi pujo hoy, gori, judi chole ashe, or some forms of them will they come back, right? And then depression, which is like the hardest depression to face. And then all these stages can happen at any time. Then the last one is acceptance. Menenalaje. And I have to honor them and try to live up to that standard. So I feel like these stages of grief and loss happen, and if there's depression, it's hard being a single parent. I think everybody knows how tough it is to be a single parent. In America, it's an epidemic actually. That's all I used to see in my office, is single moms, and some single fathers as well. But it's an epidemic, and so it's so hard. I've been trained to deal with this now, so it's so hard. But I know that first for divorced families, for single parents, there is hope, and the child does well if you treat things early. If there is an issue, some kids are resilient. Some kids need the extra help and support.
So we also have a question from Priyanka Roy, and this is something which we had discussed a few minutes earlier. She says how to stop thinking overthinking. How should we put an end to that?
So it depends on the level of overthinking, I think. So if the overthinking is taking over your sleep pattern, if it's causing excessive worrying, if it's impairing your occupational functioning or your social stratosphere, then you need to seek help. I feel like sometimes what the studies show is medication management and therapy work the best, cognitive behavioral therapy. But cognitive behavioral therapy alone also works really well. It actually beat out medication alone. So I do therapy. I love doing it. The analogy I use, and I think I've told you this before, is that medication is just anesthesia, and the actual surgery is the counseling or therapy. So if somebody wants to do surgery without anesthesia, I'm good with it, as long as they don't spill out their guts to their workplace, or that they don't they can concentrate every day. But if a little medicine helps them, and then we take it away when surgery is over, then I think that's the best format.
Absolutely. But coming back to the death of the parent, sometimes we have very old people living with us. And these people sometimes, they are very restricted to the house, so they become very, senile and very demanding. This throws off the other people of the family. What do you actually like? Do you feel family counseling over here would help?
Yes. So I think, Kolkata is becoming like a nursing home, because what happens is the older generation, as progresses, the kids don't know what to do. Some kids are even abroad, like I was, and they're coming back and they're seeing their parents change, and it's really tough.
I can relate to that.
It's very tough.
It's very tough.
To see your loved one change so much.
Yes.
And so the dementia aspect is this: we have to teach that grief and loss, what I just said, the 5 stages, to the family member, because they're also grieving. Their parent is still alive, but they're grieving the old parent, the way it used to be. And we have a lot of memories and things that come up, pujo time and all these things, that the parent will not be able to engage in. And how do we deal with this now? Now the actual son or daughter becomes the parent, and the parent becomes the child. So it's a strange dynamic.
This is exactly what I tell to my daughters as well. You know, when they say that you are taking Dima out and all that. So I feel, you know, somewhere you become the parent and they also come back to the second childhood. And somewhere you also need to restrict them as well, as we are talking about restriction from the kids. You know, maybe restricting parents saying that this is enough. You know, you have to accept what it is. Because even they are grieving the loss of their, you know, the life they had, which they are right now, they don't have. In this aspect, going a bit further also, you know, in like Calcutta especially, there are many people living in joint families, still now. And by joint families, I mean parents, and they are living with, you know, couples and families also. It's a bit of a trivial issue, but do you think the conjugal life of the newly married couple in these scenarios get affected a lot? Like and the counseling which the other parents need from this?
Yeah, so I feel like we're very intrusive people as Bengalis. I mean, I can't speak for everybody, but I know my culture very well. So, like, I really feel that we need to not be overbearing on anything, and it's easier said than done, because I feel like you know, there's not a lot of people that have that mindset that I'm just gonna lay off my daughter or son that I've raised for that long. They still are my daughter and my son, so why should I suddenly change? We change because the developmental stage demands it. So in the US, I feel like it's too much change, like I pointed out. At 18, chola jawa right? But here, we're like feeding our kids like at age 25 and 27, and like it's going on and on. It's like a delayed adolescence, and that enmeshment is not good for anybody.
Some more questions coming up. This is from Aditya Bhan. And he says, how does one overcome the taboo associated with seeking help, counseling, or treatment? Probably are talking about that only.
Yeah, it's things like this, but I mean, it's just doing something for yourself, I guess. How do you overcome the taboo? You wear it as a badge of honor, I think. I'll be honest with you. I don't know how many people will be honest, but I went to therapy. Like, I feel therapy made me a better person.
Same here. You know, there are life situations. I guess first is acceptance of your own self.
Right.
That you need to recognize that if you have, say, a tumor, will you sit at home? You won't. You will go to a doctor and seek treatment. What we don't recognize is that mind is also an organ, and you know, if that is not functioning, first we need to say to ourselves that, you know, there is a problem, and I recognize the problem, and then you go to a person. So the taboo cannot be just off, but the taboo is probably somewhere that we need to recognize it ourselves. Even I have been through therapy, and it's just not because I have a problem. Sometimes it's just, you know, good to have it, because you know that, you know, your mental health also needs that particular.
Yeah, it's a mental massage. So I'll give you an example. In our brain, I call it the subconscious. It starts at age 3. Okay, so you can do this with your children at home. Feel free to try. You can show them pictures of before 3, and they might not remember anything. And chances are they won't, unless they've been told that's what's happened. Okay, but if you show them after 3, they remember everything, details. That's when we believe the subconscious starts. All our memories are put into that box. And from that moment on, whenever we don't want to think about something, distressing, like dushchinto, it goes into that box. It goes into that box. ওই বাক্সটা যদি না খুলি, তালা আছে বাক্সের উপর, ঠিক আছে? যদি ওটা না খুলি আর একটু গুছাই, then that box becomes tight and ভেঙে যায়. When it breaks open, we can have a lot of consequences to our body. And this is what I see every day, guys. So it's nothing new. The box breaking every day. They've gone to a cardiologist, they've gone to a GI specialist, but nothing helps. But then I come into the picture, and I do some counseling, I do some med management, and their symptoms start getting better. They start noticing that they're not having the symptoms anymore. These symptoms are palpitations, having difficulty breathing, and like being literally having heat come out of your head, or being short-tempered, and tremors, and like something like what's that called, tingling, and all these things happen, and worst of all, like the heartburn or stomach ache. So all these things I've seen, and in children before exams, and in adults, just for no reason, because they feel that I have no tension, my life is good, but actually the subconscious is telling us different. Like something is happening in your body to make you go to the hospital.
Right. And like further continuing this, actually, we all have addictions. Like saying that sometimes people smoke a lot. So though there are rehabs and all, but do you feel that in case of addictions, the role of counseling comes in also? Because when people actually stop it, they actually have all the symptoms which you are also talking about. There is a withdrawal syndrome.
Right. Yeah, no. I mean, you have to, if you're on a substance, we do de-addiction in Medica as well. I mean, we do it for cigarette smoking, we do it for alcohol, we do it for strong drugs like brown sugar, things that are taboo in our society, but people are doing it. Why do you think I go to North Bengal, and why do you think Medica sends me to North Bengal? They have the highest rate of addiction in that community. So that means their suicide rate and impulsivity increases. So we have to treat that. I feel like it's my duty to treat that. And some of those people just throw away. They're just, addicted. Let's not deal with that
They're
form of
wasted.
society.
There's nothing can be done.
Yeah, just like the suicidal. Why we have such a high population? Someone commits suicide, who cares? I care. We need to change that thought process. Enough is enough. It's like we have the highest suicide rate in the world.
That's
from
nothing
that
to be
age
proud
group.
of. That's
Like,
nothing to be proud of.
I mean, in terms of women, 36% of the world's population commits suicide in our country. 25% of men of the world's population of suicide committed here. So this China and India, there's something going on with economy and the struggle and the competitiveness, and it's really adding to it. So that's why I'm saying we have to be aware. Otherwise it's just going to creep on us and it is an epidemic, it'll become a further epidemic.
What about, recently Article 377 got accepted. Many people are coming out of the closet, but but there are many other kind of people who think that homosexuality, for that matter, is something which is not normal. Do you think that it's not the person who is homosexual needs counseling, but the other people who are actually the family and everybody who can help them?
I don't know. Jano, identity is such a big deal. Like I identify as a Bengali. I identify to a certain culture, like American culture. I identify to this Indian culture because I went to Darjeeling. I identify with things. So if someone questions my identity, it's like shattering.
It's painful.
It's painful.
It's very
like, who are you to question my identity? So yes, I do feel like acceptance is needed, and I'm not saying like we should like have a a groundbreaking moment with people. Just accept your kids, listen to them. That's it. I'm not saying you have to change your philosophy,
right,
but at least accept them.
Coming back to something which we were discussing before, because we were talking about homosexuality and the sensitive side to this. Very tabooed line, Amitabh Bachchan ka line hai, "Mard ko dard nahi hota," right? So do you see more women in your profession, or do you see men? Or men in India are supposed to not speak about their emotions?
So no, you said it very beautifully. Like men are supposed to be the strong financial providers.
Yes.
We're not supposed to be the lovey-dovey, let's hug on our kids. But I hope to change that, honestly. I do feel like things are changing because as we get more and more progressive in society and westernized, we are changing. I'm not saying that we shouldn't be the strong disciplinarians. I'm not saying that at all. Please don't misunderstand. Discipline is the key. But I'm saying you can balance that discipline with love.
It's just not with the kids. I guess with right now men with kids, like our generation, or our previous generation has been bonding with kids very well. Like,
Right.
but what about their own emotional insecurity that I can't accept this. I cannot. I'm not being able to accept the work pressure, the society pressure, somebody's death. I can't accept the loss of my girlfriend, or I can't accept somebody saying something to me. As simple as I can't accept me being ill-treated in house. Like many people will, men, I feel they will shut it off. They will probably show it with arrogance. Like.
Yes, so basically you're right. Getting back on topic, that I'm saying that I feel like guys are the strong silent type, and stereotypically we want them to be that. But honestly, like I told you, the depression rates and the completed suicide rates, they might be higher in women in this country, but I feel like men, because they're, in America at least as well, they're the most likely to complete suicide, but ladies or women are the most likely to attempt them. So basically what it's showing is that we bottle down things, and until it gets too late, until a crisis moment. Whereas we could have just opened up, talked to, even simply talking to your wife about things, talking to your significant other, talking to anybody about things, because the more you keep it inside, the worse it becomes. Like it's that subconscious I told you. The lock breaks open, and God forbid, then it goes into depression and then suicide.
Yesterday in the paper it came up that Bangalore is the infidelity capital of the India.
Wow.
The infidelity has been increasing in India. I guess one of it is because of this low divorce rates. But then we are not being true to our own marriages.
Right.
There are many people with multiple affairs, but there are many people who are actually holding a long-standing affair outside marriage, and probably that is more beautiful than their own marriage.
Right.
But then morality, ethics, or it's a mental health condition?
That's a tough question. I think it's both. I feel like sometimes morality and ethics are coming into play with the situations when relationships get strained. What you don't do in a relationship, I'll tell you honestly, is lie. When you lie and you start lying, that lie becomes so big inside of you, that guilt. You shouldn't be dishonest to someone. It hurts their feelings. And once that hurt comes, it's hard to recuperate that. It's hard for me, at least as a mental health person, to take that pain away. But I do believe that sometimes mental health definitely plays a part in this, because if you're an anxious person and you have to continuously lie to keep yourself happy, or you have like a fear of abandonment, or what we call as a paternal issue, or you have a fear of abandonment for a maternal issue, meaning that you don't have both parents involved in your life, you could sometimes reach out to the wrong people if you don't get treatment or counseling.
We have a question from Aditya Bhan again. How does one deal with repeated rejections, both in personal and professional spheres?
So the way I think about rejection is that you learn from it. So I know that's kind of like this mindfulness concept of living life, but it works for me. So I'm just telling you what works for me. What works for me is to be mindful. So meaning that whatever consequence I have, if it's rejection or feeling like people don't like me, I try to learn from that. What is my body telling me, and how can I be more positive in the next regard? But it really hurts. To answer your question, it really hurts. And if it like lasts for a long time, it's good to get that out to somebody. If it's not working, to talk to your friends or your parents about it, or it could be anybody, right? Your spouse. So if you feel like it's festering inside of you and it's really affecting your self-esteem, you should really see somebody to just get it out of your system.
So we have another question from Shoma Bhan. She says, well-meaning moms micromanage their kids' lives. Does it have any long-term impact on children's mental development and ability to take decisions for themselves?
Yes, definitely. It definitely has an impact. So the longer there's developmental stages. So the longer we keep somebody enmeshed with a relationship, they're not growing and becoming autonomous. So autonomy is the key to success. What do we want? What is success? Is it to get our child to get married? Is it our child to get a good job? Is it our child? They can't do any of these things without being autonomous. They've then been stunted in their growth and development. So we have to definitely let go a little bit and become, so after adolescence, what happens, right? They test limits, they find flaws in you as parents, they do all these things, they have hormones that are going on. So, but at the end of it, the beautiful part is if you can become a friend to them, like actually listen to them and talk without passing judgment, then they're going to grow and flourish.
Yes, and there are actually even scientific studies to show that that mental and physical abuse is actually changing your genetic components. So there's this huge study called ACE, which actually documented that kids who have this emotional or physical abuse in their childhood, they grow up having different issues like multiple partners, like addictions, difference in the social behaviors, and also certain kind of lifestyle disorders like cardiac problems, diabetes. Like there are well documented studies which are showing this. So I guess micromanaging is never good. Like
no.
you need the child needs to grow, the child needs to flourish.
It's like a pressure cooker, right?
Yeah.
The more you put pressure on the child, like again, if it's social context, low-key public, or if it's inside of your home, Amar Baba Ma ki pabje, and you're putting so much pressure as they're trying to develop and become autonomous, then it might be difficult because they've already done what you've told them. They've gotten the marks, they've tried to get their careers going, and now they're moving on to the next phase of life. And that over-involvement it almost definitely really intrudes on the child's well-being.
Right. And if we are speaking about, speaking a lot about kids, what about adolescents? How do you see adolescence different in US and here? And how do you think that this adolescence has something to do with the mental health makeup also?
So we mentioned it now. So in the US at 18, you're supposed to be autonomous. You're supposed to go out and live your life and be free. That in Indian parents in America also, they don't do this. But we as Indians don't believe that. And I feel like that's a good thing. But I feel like the over-involvement is a bad thing. So again, I'm in the middle of the road with this. So adolescence over there is like, oh, there's a prom, people go to date, people are happy, the parents are sending them, giving them money to go date. Everything is so different. But here we're like so worried about what people will think if they go on a date. Will they ever get married again? If they have a selfie with so-and-so, that means that something's happened. And if something's happened, they won't get this great marriage proposal. And it goes on and on and on and on until the person is so stressed about marriage, the specific issue on marriage, that it gets overwhelming. So adolescence is the time where people, I really do feel that we're not listening to our children. We're telling them to, just be on the side, be quiet, and you're gonna do what I say because you're really rebellious right now. So where is this rebellious coming from? But honestly, that's a phase of life. Like, to rebel and be on top is a phase of life.
True. And that's a learning process also. Maybe the kid is too independent, the kid has leadership quality. Rebellious can also mean that the person has a leadership quality.
Definitely.
So that needs to be actually appreciated by the parents in some sense. With this question also, I would say that when we are, is there a question? So we have Diksha Mukherjee saying, what to do when your aging parents won't understand. I guess we had discussed this a bit earlier, but then again,
So basically, we ourselves have to undergo counseling. Just to be brief, we have to understand that things have changed, and now they're no longer our parents, and they're actually become more childlike. There are certain medications, I want to be honest with you, for dementia, but they don't reverse the memory loss or cognitive loss. They stop from further worsening. So if your parent happens to have progressive memory loss, it's always good to get a checkup. Why? Because you could prevent it from happening further. They could possibly not recognize you in the future. But besides all that, to even deal with that, to even go to the doctor, we need counseling to understand our roles have changed. We need to understand and go through grief and loss about the changes that have happened and how we can, how we can understand and better ourselves, because they're our loved ones, and it's a grief and loss process.
I guess here the first acceptance is that they also are restricted. They don't have, dementia is one part. The other part is they have also lost a life which they were living very actively. And if they are not listening, then there can be some health issues which they have not recognized. There can also be some mental issues which, they are feeling left out when the whole family is enjoying, because they, as you correctly pointed out before, they can't participate in a few things which probably they were actively participating. So even their life is changing, like our life is changing, which we probably are not catching up because we are running. Their life is changing and they are sedentary, they are in one place.
Right. Besides dementia, even my dad's fairly active. He's 68 and he does his thing. But when my mom passed away, she was our social person. So basically what happens when that happens is that first he's going through grief and loss, he's going through depression, he's becoming more socially isolative. So he's decreasing his activities and going through things that I don't want to see as a child. So coming back to India also, you can see that, you can help it, you can gently nudge it, but you can't change him. So you have to be ready that, yes, he's aging. So he's not that same guy that used to be your mentor, He's changing, but he's still my mentor. But I'm just saying, you have to understand the limitations. Things do change.
Somewhere we also need to stand up to them and recognize the fact that their life is changing and probably they will not like to do a certain thing, and accept that, rather than both.
But লোক ভাবতে পারে না সেটা যে আমি in charge. Yeah, right.
The other part related to this would be that sometimes what happens is that as it was like you were talking about medications, do you think that if I'm on antidepressants, will I be able to take it off? Like people have this scare also. যে আমি সাইকিয়াট্রিস্টের কাছে যাব, আমাকে antidepressants দিয়ে দেবে, এবার তারপর কি হবে? Do I have to follow him up all my life? Will I get off antidepressants, বা the drugs?
Yes. So basically, very good question. You can taper off medication after. What I do is I do it for 3 months, and I do the counseling, and then I taper off medication. Right. Really, what you have to think about is follow-up. এই দেশে কি হয়, একবার ওষুধ দেয় আর 5 বছর পরে ফেরত আসে। And so on and off they're doing their own doctory, right? But what I'm saying is that's not good. You have to follow up. You have to follow up, because then I don't know. That's why I give everybody my WhatsApp number. In fact, if you see my feed, I'm sure you'll see my number, because I want people to feel comfortable to say that even if they don't have the money to follow up, but I'm going to WhatsApp this doctor and say, is it safe to be off the medicine? I want people to follow up. In America, I think that's the biggest difference. Again, if I'm to compare US to India, we have insurance companies that make sure you follow up and you don't get hospitalized. So every week, they pay for your follow-up, right? Here, it's tough to come into town, to come follow up. কিন্তু করতে হয়, because যদি না করো তাহলে আরো সিরিয়াস হয়ে যাবে ব্যাপারটা, না?
So with this last questions, we will be probably ending this Facebook Live. Do you think that mental health problem is more of a rural problem or an urban problem?
That's a good question. Actually, the studies are showing that it's both. Everybody suffers from mental health issues. যেটা আমরা বলি tension. I think it's a good term. I didn't make it up. It's made up in Kolkata. But it was a funny term for me first, because I'm like, what is tension? So tension means stress here. But it's such a good word now, the analogy, because it causes tension all over your body. And what happens in the rural is that they don't follow up. They don't come in and they don't know what's happening to their body. In the urban setting, we know, but we ignore. So I feel like both are a significant impact. the whole purpose of this talk is for you guys to understand that you need to follow up. There's plenty of good psychiatrists here. Just ask them questions. Don't just blindly take their meds, and don't like just like be brushed off. Make sure that they understand the problem, take like time for you, and come back and understand you. And that's with counselors too. It's not just psychiatrists. Please, we're not mental health providers alone. Any mental health providers, there's plenty of good counselors. So please just access care. If you access care, things will change in India. I promise you.
Yes, so thank you Dr. Ranjan Ghosh and Medica Super Speciality Hospital for this wonderful discussion on mental health awareness. What I would add as an ending comment is that you might be poor, you might be broken, but your mind is a palace and you can actually reach anywhere through it. So take care of your mind, recognize that if you have a problem and it's not going away, it's not your problem. It's something more pathological, more clinical. Speak to people, communicate, and if needed, definitely visit a psychiatrist or, as he pointed out, a psychological counseling session. Give yourself that treat, and with that, we would end this Facebook Live. Thank you so much.
Thank you.